We're nurses with extensive knowledge and experience.
Graduate-level education.
And advanced certification.
We are advanced practice registered nurses.
State boards of nursing protect the public by licensing advanced practice registered nurses. Support our efforts to unify regulatory standards.
So we can continue to provide quality care.
And give you greater access.
Visit ncsbn.org to learn more about efforts in your state.
Nurse midwives have the monumental responsibility of bringing the next generation into the world. These advanced practice registered nurses conduct many aspects of gynecological care, from providing annual exams and family planning services to prenatal care to birth and delivery. The job of nurse midwives doesn't start and end in the delivery room. While they manage and treat some birth complications such as bleeding or lacerations, they also provide care in the months before birth, performing examinations, monitoring the fetal heartbeat, and identifying the baby's position and size. They record this information to diagnose, treat, and prevent issues that may arise. Nurse midwives also educate their patients about the expected changes throughout pregnancy and birth, potential symptoms to monitor, and about any procedures that their patient is considering. Nurse midwives may work independently through a private practice or on a care team at a hospital or birthing center. They may be needed at all hours to manage labor and deliveries. To enter the field, candidates typically need a registered nursing license, a master's degree, and certification. With these professionals, patients can rest assured that the future is in good hands.
My name is Kristen Dixon, and I'm a clinical nurse specialist at Scripps La Jolla in San Diego, California. I enjoy my job as a clinical nurse specialist because I get to see patients, I get to do education with nursing, and I make sure that my nurses have what they need to provide the patients with the best outcomes. People have asked me before, what is the main difference between a nurse practitioner and a clinical nurse specialist? I like to respond that nurse practitioners see one patient at a time, but they're motivated and they work with specific physicians to help those patients along. A clinical nurse specialist, they are interested in a population of patients. So either a specific disease or, cardiac, kidney, so a type of patient. We don't focus on one individual, we focus on the population and what we can do to make sure the work that's being done and the nursing practice that's being done for that group will provide us with the best outcomes. Writing policies and doing your own research too helps further extend your ability to affect patient care. Policies are like textbooks for hospitals. It's their standard of care. And within your expertise as a clinical nurse specialist, you will be updating those, making sure that your staff have the best resources to go to. Part of the CNS role is being an educator. And as an alum of Loma Linda University, I was asked to come and talk to future advanced practice nurses about real life work as a CNS. So I was able to do a lecture for them, and it was great. We got to engage and talk about what I've experienced in the last 2 years as a CNS and really excite them and motivate them for what they have coming in the future.
I think in life you have to nail down something that you ultimately need to do while you're here.
So I always excelled in science in high school and when I started college, but I also had the desire to help others.
I was an EMT in high school. I knew I wanted to go into the healthcare field.
I saw all these nurses taking care of my father, and I said, I want to be that.
I wanted to make a difference. I received report from anesthesia people. I thought they were doctors. Once I found out they were nurse anesthetists, I was hooked.
They were very caring, they were very engaged and involved.
The amount of responsibility a nurse anesthetist has is profound.
One of my colleagues told me that I have the characteristics of a nurse anesthetist, being a leader, being independent, always looking for knowledge.
Those qualities are absolutely something to look up to. It's very empowering.
Being a nurse anesthetist, there are myriads of opportunities. You can work for the military, you can work for the government like the VA.
You can take on students.
You can work as a faculty, as a nurse anesthetist, professor.
You can also participate by being active in your state organization when you become a CRNA.
There are more than 49,000 nurse anesthetists across the nation, and you're going to be joining this very strong profession.
The profession of nurse anesthesia needs and welcomes future CRNAs from all cultural backgrounds. We hope they will bring unique attributes to the holistic, patient-centered care nurse anesthetists provide every day.
As a Filipino immigrant from the Philippines, I'm always empathizing with different cultures because I know where they're coming from.
Patients feel more comfortable when their healthcare provider shares similarities with them.
Because when a patient is at the most vulnerable and they're going for surgery, they're scared. And
I wanted to be there, beat to beat with the patient.
I wanted to touch lives when they're most vulnerable.
I thought, this is for me.
to develop those qualities and then actually be someone who can execute it, I think that's just a big accomplishment.
Go for it.
Be a nurse. Be a nurse anesthetist.